Hello everyone. Today I am going to discuss a very important topic, that is bronchial asthma. In this part I would discuss about the introduction of bronchial asthma and see, it is a reversible obstructive pulmonary disease. It is a reversible obstructive pulmonary disease which affects the airways, which affects the bronchi, bronchioles. So I would define this term reversible obstructive pulmonary disease in my subsequent classes. सो सबसे पहले मैं डेफिनेशन से स्टार्ट करूंगा. आई वुड स्टार्ट विद द डेफिनेशन. सी, it is a chronic inflammatory disorder. It's a chronic inflammatory disorder of the airways, chronic inflammatory disorder of the airways, which leads to narrowing of the airways, which leads to narrowing of the airways, narrowing of the airways, and it renders the patient periodic difficulty in breathing. There is periodic difficulty in breathing, and the symptoms are chest tightness, cough, and wheeze, a whistling sound, wheeze, which is heard during expiration. It indicates lower respiratory tract infection. It indicates lower respiratory tract infection. So see, सबसे पहले मैं define करूँगा what is this which I have written. Chronic means of very long duration. Duration is very long, and onset of symptoms is gradual. Means आराम धीरे धीरे से होता है. Means gradual. It is gradual in onset. Onset of symptoms is gradual, and it is of very long duration. Basically that is chronic. Inflammation means you have studied in your pathology. That is redness, swelling, heat. Basically that is inflammation. Cardinal signs of inflammation, you know. And it is a chronic inflammatory disease of the airways, that is of the bronchi and bronchial tree. It leads to narrowing of the airways. There is narrowing of the lumen. See, this is normal lumen, and after this bronchial asthma, there is narrowing of the lumen. So passage of air is reduced. It gets trapped inside during acute attacks. During exacerbation, the air gets trapped inside, and there is periodic difficulty in breathing. Due to narrowing of the airways, the air gets trapped inside during acute attack, and there is difficulty in breathing. And symptoms are, that is difficulty in breathing, tightness of chest, cough, and wheezing sound. That is a whistling sound which you hear during expiration, and it indicates lower respiratory tract infection. When you auscultate, you hear a wheezing sound during expiration, and it indicates lower respiratory tract infection. One more important characteristic of this condition, is airway hyperresponsiveness. Airway hyperresponsiveness it is a very important characteristic of this condition. देखिए, इसका मतलब क्या होता है? एयरवे हाइपर रिस्पॉन्सिवनेस, AHR, एयरवे हाइपर रिस्पॉन्सिवनेस. Basically there are a lot of triggers, there are a lot of triggering events in the environment, like dust, pollen grains. So when a person inhales, a little amount of that environmental allergen, of that triggering factor is enough to stimulate this condition. A little amount of it is enough to trigger or stimulate this condition. The airway becomes very more active, it becomes hyper responsive. A little amount of it is enough to stimulate this condition, like dust, pollen grains, cat fur, various kinds of foods. So basically this is airway hyperresponsiveness. Now I would be talking about the classification of bronchial asthma. See, according to the type of antigen, it is of two types: early onset, late onset. Early onset, it is atopic, late onset it is non-atopic. Early onset atopic, late onset non-atopic. Early onset means you can see on the name only, जब ये it happens during the childhood, it happens during the childhood, and this late onset it happens during the old age, it happens during the old age. Atopic means some individuals are genetically susceptible to environmental antigens, to environmental allergens like dust, pollen grains. So it is also called as extrinsic. It is also called as extrinsic. It is also called allergic. It is also called as extrinsic. It is called allergic. It has a family history. Family history is positive. So basically this is early onset, atopic or extrinsic allergic. And this counterpart is late onset, it happens during old age, it is non-atopic. It is caused due to environmental factors like the respiratory viruses, influenza, para-influenza, rhinoviruses, and also fumes, smoke fumes. So it is caused due to environmental factors. It is non-atopic, it is intrinsic, and it the family history is poor. Family history is poor, and family history is negative, family history is positive. So basically this is early onset, late onset, atopic, non-atopic. Now according to the triggering events, this is the second part of the classification. This is the first according to the type of antigens, and this is according to the triggering events. We have seasonal, wait, I'll write here. According to the triggering events, we have seasonal, occupational, seasonal, occupational, drug induced, exercise induced, cough variant asthma, CVA, cough variant asthma, and asthmatic bronchitis, So according to the triggering events, we have, according to the trigger, we have seasonal, occupational, drug induced, exercise induced, cough variant asthma, and asthmatic bronchitis. So see, seasonal, some thode seasons में like spring and all, the pollen grains are there in the environment. There are a lot of pollen grains in the environment like spring, summer. So basically in some seasons asthma is very common in the hospitals. So it is seasonal. According to the seasons, the incidence of asthma is more. So basically that is seasonal. Occupational, the dust particles. Some individuals who work in factories are exposed to dust particles, occupational lung disease, silicosis, asbestosis. So basically that is occupation, dust particles exposure in industries. So that is occupational. Now drug induced, some drugs like non-selective beta blockers, propranolol, they cause bronchoconstriction, and they can precipitate an attack of asthma. Also drugs like aspirin, NSAIDs, ACE inhibitors, they can also precipitate asthma. So non-selective beta blockers, propranolol, aspirin, ACE inhibitors, they can precipitate an attack of asthma. So that is drug induced. Exercise induced, when some individuals are doing exercise, they can precipitate an attack of asthma. Cough variant asthma, इसमें क्या होता है कि the cough is the only symptom is in this case. So other symptoms like wheeze and all, they are not found, only cough. So it is cough variant asthma. And see, this is important, asthmatic bronchitis in chronic smokers, they tend to develop asthma. Chronic smokers tend to develop asthma. So that is asthmatic bronchitis. So this is the classification according to type of antigen. early onset, late onset. Early onset means atopic or extrinsic or allergic, and late onset it is non-atopic or intrinsic. According to the triggering events: seasonal, occupational, drug induced, exercise induced, cough variant asthma, and asthmatic bronchitis. So now I would be talking about risk factors which help in the development of bronchial asthma. So risk factors, the first, it is genetic predisposition. Some individuals are genetically susceptible to environmental antigens, to environmental allergens like dust, pollen grains. So see, basically it is a type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction or anaphylaxis. You should remember this part. Susceptibility locus is on chromosome 5q. It is on chromosome 5q. So basically type 1 hypersensitivity reaction आपको पता ही है. Allergic manifestations, when insect bites you tend to develop allergic manifestations and you go into anaphylaxis, anaphylactic shock. So basically that is the same thing. Type 1 hypersensitivity reaction in genetically susceptible individuals. And you should remember this. Susceptibility locus is on chromosome 5q, long arm of chromosome 5. The second is the atopy. Basically it is the same thing, means genetic susceptibility to environmental antigens. So in atopic individuals, I have told you earlier, it has a positive family history and it has genetic susceptibility to environmental antigens. So remember this, they have a higher level of serum IgE, they have a higher level of serum immunoglobulin E levels, immunoglobulin E level, which is a mediator of type 1 hypersensitivity reaction. You know that basically B lymphocytes, they release immunoglobulin E once they are activated by the T helper 2 cell associated response. I would explain you in next part. So basically they have a higher level of IgE levels, which causes this condition, that is bronchial asthma, type 1 hypersensitivity reaction. And see, gender and age, it is more common in boys. I will write here, it is more common, this is the third, gender and age, it is more common in boys than girls, and it usually occurs below 25 years of age. You should know this. It is more common in boys and it occurs less than 25 years of age. So gender and age. One more important characteristic, it is airway hyperresponsiveness. I have told you, airway AHR, airway hyperresponsiveness. So इसमें क्या जाता है, there is bronchoconstriction, there is contraction, bronchoconstriction of the airways, और उसी की वजह से पेशेंट को सांस लेने में दिक्कत होती है. There is bronchoconstriction, there is narrowing of the airways, that is bronchoconstriction. So a little amount of the triggering event like environmental antigen like dust, pollen grain is enough to stimulate this condition, is enough to cause bronchoconstriction of the airways. So basically that is airway hyperresponsiveness. So now I would be talking about environmental risk factors. So in this there is a hygienic hypothesis. इसका मतलब है कि those individuals who lacked any kind of infection during the early childhood, they tend to develop asthma when they grow old. They tend to develop asthma when they grow old. They tend to develop asthma when they grow old. See, ये क्यों होता है? Because if they are not exposed to any kind of antigen, any kind of allergen, then they would not develop immunity. They would not develop immunity against this condition. They would not develop immunity against this condition. And once they grow older, they can precipitate this condition, that is bronchial asthma, because the immune system is not strong enough to fight this condition, because they are never exposed to this condition. So देखिए, environmental risk factor, hygienic hypothesis means those individuals who lacked any kind of infection in the early childhood. Once they grow old, they can precipitate an attack of bronchial asthma because they have not developed immunity. They have not developed enough immunity to fight this condition. जो फार्मर के बच्चे होते हैं, दे आर एक्सपोज टू अ लॉट ऑफ एंटीजन. दे आर एक्सपोज those individuals who develop in dirtier environments, they tend to develop a good immunity. Against this condition. So once they grow older, the chances of developing this condition are less. So basically this is hygienic hypothesis. So now I would be briefing you about bronchial asthma. In this chapter I have discussed about the introduction of bronchial asthma. So first I begin with the definition. मैंने definition explain किया है. So see, it is a type of chronic inflammatory airway disease. Which leads to narrowing of the airways. There is narrowing of the airways, and so it renders the patient periodic difficulty in breathing. There is periodic difficulty in breathing during acute attacks because the air होता है वो trap हो जाता है. There is trapping of air inside the lungs and patient gets difficulty in breathing. So the chief complaints are difficulty in breathing, chest tightness, cough, and wheezing sound. It is a whistling sound which you hear during expiration. One more important characteristic is airway hyperresponsiveness, which I have taught you. It is a little amount of environmental antigen like dust, pollen grains is enough to trigger this condition. The airway becomes more active. It becomes hyper-responsive. There is bronchoconstriction after the patient inhales the triggering event. There is bronchoconstriction. So basically this is the definition. Now I would talk about classification. In classification, it is according to the type of antigen. It is early onset, late onset. Early onset, atopic or extrinsic or allergic, and late onset it is intrinsic or non-atopic. Now according to the triggering events, seasonal, occupational, drug induced, exercise induced, cough variant asthma, and asthmatic bronchitis, which you see in smokers. So this is the classification. And at last I talked about the risk factors. मैंने risk factors पे बात की. That is, first is genetic predisposition. It occurs in genetically susceptible individuals who are genetically susceptible to the antigens, to the environmental allergens. So it is a type 1 hypersensitivity reaction. That is anaphylaxis. Susceptibility locus होता है, it is on long arm of chromosome 5. It is on 5q. The next risk factor, atopy. Basically it is the same thing. In atopic individuals there is increased serum IgE levels. You should remember this. Airway hyperresponsiveness, next risk factor. Basically I have explained you airway hyperresponsiveness. Then next is the gender and age. It usually occurs in boys, more commonly in boys than girls, and age, it usually occurs before 25 years of age. Then environmental risk factors, hygienic hypothesis. बेसिकली जो इंडिविजुअल्स होते हैं, दोज आर नॉट एक्सपोज टू एनी काइंड ऑफ इन्फेक्शंस, टू एनी, दे लैक एनी काइंड ऑफ इन्फेक्शंस ड्यूरिंग द अर्ली चाइल्डहुड phase. During the early childhood, they tend to develop this condition once they get older. Basically this is the risk factors. Thank you.